This episode of the Pain Education Corner is sponsored by the Comella Foundation. The Comella Foundation is committed to relieving pain naturally using osteopathic healing principles. Here at the Comella Foundation, we envision a world where people achieve their maximum potential by being empowered with knowledge and skills to heal themselves and others. This information is to be used for educational purposes only and not to be construed as medical advice. If you have any questions or concerns, please consult a licensed healthcare professional. Hello, it's Bill, the Knee Pain Guru, and welcome to the Pain Education Podcast, sponsored by the Comella Foundation. Today we have a very special guest, and it's really exciting for me to have the first local guest, local to me. So I'm kind of excited about this. This podcast reaches all around the world, and it's exciting, and we can help people on 6 continents. However, I have someone in my very own hometown in Weaverville, North Carolina, and I'd like to welcome today Angel Trail. Welcome, Angel.
Hi, thanks for having me.
Oh, it's fun. I've really been looking forward to this interview, and we connected on an online business networking group, and I reached out and I went and visited you and what you were doing. I was just absolutely intrigued by how you help people. Your story over the past year has been pretty amazing, what you did with your business over the past year. And I'd just like for you to share, well, let's start with your expertise, your background. How did you get involved in what you're doing?
Well, I'm a physical therapist, and I was exposed to physical therapy actually by my grandmother, who was a physical therapist. And so I would go to work with her, and that's how I learned about physical therapy to start with. And so then after college, I went and got my master's in physical therapy. And so physical therapists, they go to college, and then they go to, postgraduate school, like to get the master's or the doctorate.
Mm-hmm. And where did you go to school?
I went to UNC Chapel Hill.
Oh, okay.
Yeah.
Got it. And so what ages were you doing your understudy with your grandmother? How old were you?
I was 9 and 10, I guess.
Uh-huh.
And she was working in nursing homes, and I just saw a lot of older people that needed help, and that was what appealed to me at the time, was just helping people. I just wanted to help. So I guess that's always been something in me. I've been drawn to helping people.
Mm-hmm. So. Was there any instance in your life, something that directed you to go to physical therapy school? Was it a crisis, or sometimes people's paths were dictated by some sort of something that happened to them? Was it anything other than your grandmother?
Well, yeah, actually I did have some back pain that I developed like when I was doing martial arts. So I was big into capoeira, which is a Brazilian martial art kind of dance. And I was training that really intensively during college, and I got some back pain, and it didn't go away. And I went to the doctor and chiropractor and physical therapy, and got like a x-ray and an MRI and all that stuff. And basically it just, none of it answered like why I was having pain. And so I was just kind of living with this pain for a number of years. And I stopped doing martial arts. And so I guess part of going to physical therapy school was wanting to figure out like why I had pain and what to do about it.
Hmm. Now, when did the back pain happen in relationship to you going to college? Was it happening during college? Was this something that happened before?
The back pain developed during college when I was like 19 or 20.
Uh-huh.
And then I had it, all the way through partway into physical therapy school.
Mm-hmm.
So I had it for at least 5 years.
Wow.
Mm-hmm.
Okay.
Mm-hmm.
And how did the back pain get resolved? Like, what was the piece that you put together?
Like, just to simplify, I needed to strengthen my hips.
Oh.
There was nothing like structurally wrong with me. I just needed my hips needed to have more tolerance to the activities that I was wanting to do. So when I was doing my martial arts and stuff, it was just like too much on my hip muscles. And the trigger points and stuff in my hip muscles were radiating pain out, and also my back was not being supported enough by my hips.
Got
and
it.
so when I strengthened up my hips, that took care of it.
Oh, cool.
Yeah.
So let's see, physical therapy school, you graduated. What was your path after graduation?
So after graduation, I worked in an outpatient orthopedic clinic. That was like really busy. And so I got exposed to like a lot of different things. And basically right out of school, I felt like I didn't know anything. Didn't know what I was doing. Was like helping, it was like 50-50 if I was going to be able to help somebody or not. Like people just turned out to be much different than textbooks. So the practice of physical therapy was a lot different than what I had learned in books, and people didn't go by what I had learned in the book. And I just felt really incompetent, really overwhelmed. It was, in these outpatient orthopedic clinics, like you will see a lot of patients per hour. So it was stressful at first when I got out of school.
I could imagine. And how long did you do that? What was the transformation beyond, or the evolvement of your work beyond that?
Yeah. So then, well, then for family reasons, I had to move, and I couldn't find an outpatient orthopedic job where I was. And so I ended up working in nursing homes and home health for a while. And so it was like a slower pace. And so I got to get used to like a lot of the things that are required of me as a physical therapist, and at a slower pace, because when you work in nursing homes and in home health, it's just one-on-one care for an hour at a time. So that was really nice for me to kind of slow down and just get my feet on the ground a little bit better. And then throughout the whole time, I just started taking a bunch of continuing education classes, just trying to learn more and more about like, why couldn't I help everybody? And, what were more ways that I could help people? What was I missing, and how could I be better and help more people? So I have taken a lot of extra classes over the years.
Any of those classes kind of stick out to you more than others that helped give you insight?
Well, yeah, recently, I've really enjoyed the Institute of Clinical Excellence. I just really like their approach to the human body. It's more like viewing the human body as a strong organism that responds well to load, and focuses on active treatments but also incorporating passive treatments, hands-on approach to help people with their pain, but then also a big focus on active treatments that help people manage their pain on their own and get stronger and be able to do the activities that they love. So, I had taken a lot of classes that were more focused on passive treatments and how, we as therapists were going to fix people by putting our hands on them, and also seeing people more like they're fragile, like, oh, they shouldn't bend this way, they shouldn't do this particular movement, people shouldn't sit in this posture because they're so fragile that those things can hurt them or like permanently injure them. And so, yeah, the Institute of Clinical Excellence has more of a view that people are, strong and resilient by nature. And so I like that a lot.
Cool. Can you share a little bit more on what would the passive therapy and an active therapy? Could you describe those a little bit more?
Yeah, so a passive therapy is where you're going to be laying on a table, like the client or the patient will be typically lying on a table, and they'll be having a practitioner do something to them. Whether that might be like releasing their muscles or, putting them back in alignment or different things like that. Passive treatments where the client or the patient doesn't have to do anything.
Mm-hmm.
And then an active approach would be where the patient or the client is doing movements or exercises or activities that help to heal their body and decrease their pain. And so they develop more control over how they feel.
Mm-hmm.
And they're not relying on somebody else to fix them. And they're also activating their natural processes that are, that our body has of like, when you move a joint, you're going to lubricate that joint. You're going to increase the health of the joint. When you contract a muscle, same thing. You're going to increase the health of that muscle and have decreased pain. So those are things that you can do for yourself, the active approaches.
Got it. Okay. It makes total sense. Could you, when working with a client, painful joint.
Yeah.
Activity lubricates the joint. Totally there with you. How do you find that balance between, because sometimes activating the joint, moving the joint can actually cause more pain.
Mm-hmm.
And if you don't move the painful joint, it's not going to get better. So like, where is that balance for you? How do you find that place in working with a client that is struggling with herniated disc in their back? A frozen shoulder, something going on with their hips or their knees. Could you share how do you look at that? Where do you find that balance?
Yeah. So the first thing is the pain in the moment that we're doing the particular activity. So if we're moving a painful knee and the person's pain is 3 to 5 out of 10 at the most, then that's okay, as long as it's okay with them, because different people have different tolerances to pain. So if the level of pain that they're experiencing, if they're okay with it in that moment, then it's okay. That's the first thing. And then as we're doing that movement, how does the pain change? Mm-hmm. So does it get better as they continue the movement? That would be an indication that's a good movement to do. Like, yeah, it started out hurting a little bit, but then as you did a few repetitions, it's starting to get better. Mm-hmm. If the pain starts increasing as they're doing the movement, then we'll, discontinue that. So it's showing that that's not a good movement to do because the pain is going up, maybe above a 5 out of 10, or just to a level that the client isn't okay with. If they're not okay with it, then it's not okay. If it stays the same level and like we're, working on some range of motion that we know that they need, if we can't get their range of motion, the movement in the joint, then we can't return it to normal. So if we are getting some good range of motion and like the pain is staying the same and the patient's okay with it, then that's okay too. So that's like in the moment of doing the exercise. And then you're going to see how the person responds. Do they get sore the next day or later that day? If so, how much? Is it like, is it above a 5 out of 10? Is it really like messing with their quality of life? Then if so, we'll probably dial it back a little bit the next time. Or if they have a flare up that lasts longer than 24 hours, then that's a sign that we might, dial it back a little bit the next time. But if their pain is, okay for them and it resolves within 24 hours, then I would call that like a favorable response. And that means that the exercise that we did was okay. And it's going to increase their tolerance, maybe their mobility, their strength, whatever it is that we're working on.
Okay. Here's a question. Working with clients.
Yeah.
What do you do with the client that's like, I could take it. It's been, they have almost like that. It's okay. It's like that badge of honor they're wearing. Like, I could really handle this pain. You could push it as much as you need to. How do you work with that kind of client?
Well, so sometimes I'll just, I'll let them do their thing, where they're just like pushing it really hard, and then when they come back and see me and they're terribly flared up, then I just draw their attention to that and I say, because you pushed it really hard, that's why you've had so much pain over the last few days. So I think that we need to take it. I think we need to take it easier. And usually they're on board with that, usually they've been really suffering, for the last few days. And they're like, yeah, you're right. And they'll listen to me and we'll be more conservative. But yeah, that is a thing. You kind of have to slow some people down, but it's like there's the people that are really afraid of pain and then the people that, don't want to listen to it at all. And so we try to get, both of those extremes to kind of come into more of a middle ground where they feel their pain, but they don't get too afraid of it. They respect it. They listen to their bodies, but yeah.
That's really good. I like how you said respecting what's going on with their body. And I think that's important. And I absolutely see both of those extremes where people are either just self-abuse to the hilt, or they're like so terrified of feeling any sort of discomfort or anything in their body that they're totally holding back.
Yeah.
Which of course makes all their issues compound because the joints aren't getting lubricated like you were talking about before.
Yeah.
So the thread that we really wanted to emphasize in this was the strength and resilience of the human body. That was like the angle that we were really going to talk about today.
Yeah.
And of course, as it relates to pain, like how can we make the body stronger and resilient if it hurts? So what has been your experience in working with clients? Like, how do you see this playing out with your typical client that comes to see you?
So when people come to see me, they're often very afraid of movement, and they have ideas about themselves and their bodies that they're, for example, oh, my knee has arthritis and it's just, I just don't move it anymore. I'm just going to kind of wait till I get a knee replacement. It's just, don't even worry about my knee. That's not even what I'm here for. Like the knee it's done. It's gone. Forget about it.
Right.
So I work with people on those ideas that they have about their limitations, and introducing other possibilities that, maybe you actually can move your knee. Let's see, what we can do with it. And so I'll just start small with whatever they can do without pain or with very little discomfort. And more times than not, if you just start with something that's, comfortable, you can progress towards things that people thought that they wouldn't be able to do before. So I guess starting with things that are not painful, that are comfortable, and just starting at the beginning, and then just gradually progressing more and more, whether that's a knee that's stiff and just gradually increasing that range of motion where the person didn't think that was possible, and starting to contract the muscles around the knee in very basic ways, like maybe isometrics, and that turns into active movements, and then that turns into sitting and standing from a chair, and that turns into a squat. When the person came in, they thought, they'd never be able to squat again with their supposedly arthritic knee. And, fast forward a few months and they can do those things.
They have full range.
Yeah. Or, they a much improved range, or, something like that. And or the same thing happens with like bending forward. People think they can't, oh, my back hurts, I can just never bend forward again. And we do the same process there, starting with non-painful movements in the back, and just anything that they can do comfortably, and just progressing from there until people, can bend over and lift heavy objects from the floor, where they had this preconceived notion that they'd never be able to do that. So
I'd like to ask you a few questions more about someone who would be looking for a physical therapist to work with. You strike me as a very sensitive and caring person that isn't moving people through like on a conveyor belt.
Right.
I've got, and unfortunately, the work that I do, I run across a lot of people who have had physical therapists, and they are kind of running them through on a conveyor belt. It's like, okay, well, we had the insurance codes that we need to bill for this, and we're supposed to do this for 10 minutes and this for 15 minutes, and we bill it and you go on your way. And a lot of times those people are still in pain. So there's a lot of people out there suffering. You know this, I know this. And I'm someone who is looking for a physical therapist like you, who cares, and that is truly looking for, like, how can I work with this physical therapist to help me get better? How would someone find a person like you? That, because if I look in the dating myself, the phone book, but you do a Google search and you have a bunch of physical therapy clinics, how would someone ask? How would someone know that's in pain? Because pain, like, I can't think. I just want to get out of pain. So I want to go to somebody.
Yeah.
But not all physical therapists are created equal. I want to find somebody like you. I want to find someone that cares about me, that can help me out of pain. Yeah. How would I do that when I'm in pain? What could you walk me through that possibly?
Well, You can Google physical therapist near you.
Okay.
And then from there, what I would say is just don't go to any of the chains or corporations or hospital systems, because I've worked in those, and as a therapist, you just don't have control, over how much time that you spend with people and like all of the things that the services that you can provide. So for example, like I have my own business now because I couldn't operate in that for-profit, like corporate system, so looking for a privately owned practice
Mm-hmm.
is a good idea, because there's a reason why
Ah,
people have opened their own private, why a physical therapist would have opened their own private practice, because it's not an easy thing to do.
right.
So there's a reason that a physical therapist would be practicing on their own. And a
Mm-hmm.
lot of times it's because of that. They can't operate in that, one patient every 30 minutes system. So find somebody who's in private practice, and then just call and for me, like if somebody calls my practice, I talk to the person personally. So you're not really going to be talking to a receptionist like if you call my office. So that's great if you can actually talk to the physical therapist. Sometimes you can't. And then yeah, maybe looking on the website and seeing like what do they say about their values and the treatment that you're
Mm-hmm.
gonna get there. Like, do they say one-on-one care, and stuff like that?
Mm-hmm. I think this is all really great stuff. A physical therapist is in private practice.
Yeah.
Ask them if they have one-on-one care. See if
Yes.
you're speaking directly with the therapist that you would be working with.
Yeah.
Check out their website for their core values or how they work with or treat their patients. Those
Yeah.
are huge. I think
Yeah.
that's going to help people who are in pain. That we'll definitely put that in the show notes.
Yeah. And the other thing is knowing that you have a choice. Like if you go to the doctor and your doctor gives you a prescription for this particular physical therapy place,
Mhm.
you can take that prescription anywhere. As the consumer, you always have the choice of where you get physical therapy.
Mhm. Got it. I like this. And this, I know this isn't exactly what we said we were going to talk about, but I thought it would be super important. Like, I was thinking about this because people don't know. I know there's
Yeah.
things where I'm looking for, let's say, a dentist. How do I know one dentist is better than another? They're all dentists.
Yeah.
So, how can a person break it down? Because I think breaking it down into a baby step that they could digest. And I'm definitely going to put those in for the replay of this so people can do that, have a checklist that they could go through. Is this
Mhm.
person in private practice? What do they say about their core values? That's perfect. Thanks for tuning in to today's episode of the Pain Education Corner. If you have a special talent or skill to relieve pain and you'd like to become a guest on our show, visit us at thecomellafoundation.org/interview. Help us spread the word on eliminating pain and suffering in the world. That's thecomellafoundation.org/interview. That's great. So that was a slight detour, but let's go back to about the strength and resilience of the human body and healing pain. Um, so when you see a person, how do you, I would, based on our interaction, our talking, you hold a higher vision for that patient than they are holding for themselves because they aren't really sure what the possibility is. Where do you see is the upper limit for a person that you're helping? Uh, their healing potential.
Um, I don't set a limit for them. I just, yeah, I don't set a limit because I don't think that we really know
Mm-hmm.
what the full potential of somebody is, and people can surprise you. They can surprise themselves. So I just, my ideal, I'm always trying to return people, you know, back to normal or as close as they can get.
Mm-hmm.
I mean, there's some exceptions to that, like with nerve damage or, bones that healed in the wrong angle and, stuff like that. But
Mm-hmm.
as far as like, I'm trying to get people with minimal pain
Mm-hmm.
and doing the activities that they love that are meaningful for them.
Mm-hmm. Do you have any stories that you could share with us? Of course, no names.
Yeah.
No, no names, but you share with you somebody that came in with knee replacement, or they had bone on bone arthritis, or they had herniated discs in their neck or back. Would you share some stories
Yeah.
of someone that came in, you worked with them, kind of give a time frame, and then what did they look like on the other side? How was it for them on the other side of
Yeah.
working with you?
Okay. Sure. My time frames will probably be off, but
Okay.
give you a
Give,
rough
give,
estimate.
give or take 5 years.
Yeah.
We're good.
um, yeah. So one patient comes to mind that was an 80-year-old woman
Mm-hmm.
who she had to go to the emergency room because she had lost like her leg was giving out on her because her stenosis was so bad in her back that it had was starting to impinge on her nerve so that it was causing her leg to get weak and causing her to have severe pain in her
Mm-hmm.
leg, and she had to go to the emergency room for this. And the doctor there wanted her to have surgery immediately, and she didn't have family with her at the time, so she didn't want to make a decision like that, and she just didn't want to get surgery. So even though the doctors were recommending that, um, she said no to the surgery to, whatever, like open up the space where her nerve was coming out of her back and reduce the impingement on it. So I think they gave her probably some steroids to calm down the inflammation, and she ended up in the physical therapy clinic that I was working at for physical therapy after she got back a little bit of function in her leg. But when she came to see me, she had been previously, she was walking without a walker or anything prior to this incident. It came on suddenly. And so when she came to see me in the clinic, now she was walking with a walker. She could barely put weight on that leg. She was in extreme pain. And, a lot of what we hear in the, a lot of what we hear is that when we have stenosis and when we have a pinched nerve, there's nothing we can do about it. Like that's just bone pushing on a nerve, and it's just always going to be like that. And you got to get surgery. But then, so we started with exercises that relieved her. So, opening up the spaces in the spine where the nerves pass through, like stretches that would open that up and give the nerve more space,
Mm-hmm.
and just some basic like isometric muscle contractions, and using the walker to take pressure off of that side. And we did some dry needling too. So some like dry needling is when you use acupuncture type needles, but with a different thought process for how to use them.
Mm-hmm.
So we did some dry needling for her pain and
And just,
inflammation.
if I could just interrupt you there for
Yeah,
anyone
please.
who's listening that isn't familiar with dry needling, it's not actually poking the skin. Is that correct?
It's the needles going into the body,
Oh,
like
okay.
acupuncture.
I did not realize that. Please go ahead.
Yeah. Yeah, it's just like acupuncture. The needles go into the skin, but we don't work on like chi and the
Meridian.
meridians
Okay.
and stuff.
Got
We
it.
work on muscles and nerves.
Got it. Okay.
So yeah, we did that, and with that, we were able to get that inflammation and that pain down, so that within 4 weeks, she
Mm-hmm.
was most of her pain was gone. She was able to start using a cane. And then it was a process from there of, months of strengthening up the muscles that had been affected. But the nerve irritation, like when given the opportunity, calmed down. It wasn't like a permanent thing that she was going to live with. It was something had gotten irritated in her back, and that irritation, that inflammation had irritated the nerve too, and had affected the nerve. And when we calmed that down, the nerve pain calmed down, and then we were able to strengthen the hip muscles and the back muscles, and over the course of months, get her to the point where she was able to be pain-free, walking without a walker or a cane or anything. She was back to normal.
Nice.
So
Nice. I always wondered
yeah.
about stenosis. That was one that was kind of a little bit off in the, couldn't quite wrap my brain around that, but that's great.
Yeah, stenosis is like, it's where it's actually a normal process that happens to everybody as they get older. Like the canals where the nerves come out of the spinal cord, they just start to narrow. It's kind of a natural process of aging. And but sometimes it can start to impinge on the nerves, but that's not always problematic either. It's really just when the area gets like one part of the spine maybe gets overloaded or irritated, and that's when that irritation will start to cause pain in that area, and potentially down the nerve. So if you took an x-ray of anybody's back, like over the age of 60, 70, you're going to be seeing stenosis, and it's not necessarily going to cause any problem. So just because you have stenosis doesn't mean you have to have pain.
Okay. That's
And
the
even
first
if you
time I've
have
heard
pain
that.
with
Yep.
stenosis, doesn't mean that there's nothing you can do about it,
Sure.
and you can
Got it.
even relieve your pain without ever change. You're never going to change the stenosis, but you're going to change the pain.
Sure. Okay.
Yeah.
Got it. Okay. No, it's good.
Okay.
I'm learning. This is good. I like it. Okay. What do you see are the big pitfalls when clients come to see you, when patients come to see you? Like what are they doing that is they're getting in their own way?
Yeah. One of the main ones is being afraid of pain and stopping moving.
Mm-hmm.
So feeling pain and thinking that it means that something is damaged, and thinking that they shouldn't do anything else. Like if their knee is hurting, then thinking that their knee is damaged and that they just shouldn't use it anymore, and that use is bad and damaging.
Mm-hmm.
When really, pain doesn't always equal damage. Pain is an alarm system in our body that, just lets us know. It can let us know that there's been damage, but it might, be letting us know that we've been putting increased pressure in an area, and that we need to, be careful. It doesn't always mean damage.
Mm-hmm.
And it's not even always about tissue stress. Pain also happens because of life stress, because of beliefs, because of lack of sleep, emotions. All of those things affect pain. So yeah, we don't need to be as fearful of pain as people are frequently, and we need to move our bodies even when there's pain in an area, and try to find ways that we can move that don't increase our pain.
Sure. And this ties right back into what you were talking about at the beginning. Judging the pain level, you want to have a range where you're getting the range of motion. You're moving the body, but it's not causing more problems in the process, that it's not
Yeah.
going above that. I believe you said a 3 to 5-ish.
Yeah, that's a guideline that's helpful for people.
Sure.
Yeah.
And it's going above a 5. Well, maybe it's time to back off. When a person is backing off from that, what would you suggest they do in the back off? Because sometimes the back off could actually make the situation worse if they aren't backing off in a way that's productive.
Yeah. So finding other movements that the body can do. So if your knee hurts, like your knee hurts when you're running, so walk for a while instead of running. If you like to work out your upper body. If your knee is hurting, so work out your upper body. Or just and that's the thing that I help people with, is finding movements, because people don't always know. They're out of ideas. They don't know what to do. So that's one of the things, is I help people find movements that they can do that are not aggravating. But if people have a movement vocabulary, or they have some ideas about different movements they could do, it's just choosing the ones that don't bother them for a while. And then also really important to look at your life, like from the big picture, like what's going on. Like, are you stressed about something? Have you had a big life change? Are you sleeping enough? Are you eating well? And because pain may not be just because of like some kind of physical problem, it can be something that's going on in your life too. So looking at that and assessing and trying to overall improve your life.
And is that where is the line for a physical therapist in terms of suggesting things? Because I know there's definitely, when we start talking about, I guess there's different parameters with all different types of therapies. Some are more comfortable going in the area of nutrition and supplementation. Others are more like lifestyle change and things like that. Can you describe to me, where is the parameter for a physical therapist, or is that going to depend on their training? What is?
Yeah. So physical therapist is a direct access practitioner. So that means like that we should be able to, for any person that comes to us, that we should be able to refer them out as appropriate, like to the appropriate person. So we should be able to assess what's going on with that person, and to know if it's within our scope of practice. And if not, then we're referring out to mental health practitioner, nutritionist. But we can cover the basics. We can educate people about how all those lifestyle factors will play into their pain, and just kind of ask them the basics of, how are you eating? Like, are you drinking like soda all day? Then that's within my scope of practice.
Yeah.
To say that's not good. So there's some the basics of nutrition, we make sure that that's covered. If it's it's more complicated, then we can refer them to a nutritionist. And then, there's some screens for mental health stuff or emotional stuff. If they have, signs of depression or anxiety, we can refer them to somebody for that. But just educating them about how all those factors might play into their pain.
Mm-hmm. Yeah. I just had this funny visual. I noticed, Mr. Smith, as I was moving your leg, a Mountain Dew fell out of your back pocket.
Yeah.
You may want to put it in your front pocket because it makes your sit bones off balance.
Yeah.
Lifestyle changes. Angel, this has been great. I'd like to share with everyone, we had chatted about something for the listeners and the
Yeah.
watchers of this.
Yeah.
Could you speak to that a little bit?
Yeah. So I have a video instructing in some of the most common or one of the most common things that I see that contributes to pain, especially back pain, that I want to share with people and share how to change that. So I have a short video that you can share the link to about
Okay.
that.
Awesome. I'm excited about that.
Yeah, and I also have, sorry.
No, you're fine. Go.
Well, I also wanted to say I have a new physical therapist at my practice in Weaverville. And so to celebrate her arrival, we're doing a day of free screens, just like a free exam. And we can do that by telehealth or in person.
Ooh,
so
cool.
Anybody who is watching and would want to take advantage of that, it is Friday, April 30th and Saturday, May 1st. I don't know if you're going to post this by then, but
we will. Yes. And in doing that, and this is something we haven't talked about, but this is not going to be a gotcha thing. It's something that we were working on through the Comella Foundation for the Pain Education Podcast, to be able to offer a way where those who are looking for support can go through the website, through the Comella Foundation website, to be able to access you, to schedule times to work with you. That it would be from the client's perspective, the patient's perspective. This would be donation to the website, and it would give you an opportunity to screen them, help them, whatever. And then if they chose to become a patient, a client with you and work with you, they can do strictly over the internet and work with that.
Cool.
So that's something we were working on in the background. We haven't yet divulged until, I guess, now, because it's been this past week we were talking about it. The team was talking about how to pull that together.
Awesome.
So yeah, we will, after this, we will make sure you have all of the information on how we can get that set up to pass along people that you can help. So that would be very cool. So we'll have the bonus. We'll have the link that they could contact you directly and schedule a time to be able to set that up, to have a consult with you.
Yeah.
And let me see what else we got here. Is there anything else? Is there a thread that I didn't follow through enough in asking you today? Is there anything else that's kind of sticking out that you were like, well, I wish Bill would have asked me about that? You have the floor, whatever you would like to share.
Gosh, I don't know. I can't even remember now what we talked about.
Okay, no worries.
Was there anything that you wanted to question?
No, I was good. This turned out, this was actually, I enjoyed the piece that we got out of the finding a physical therapist. I think it's really important. I think that's going to be awesome for people who, because I talk to a lot of people and they're like, physical therapy just puts me in pain. And I know that is like a blanket statement, but people don't know how to find one that isn't going to put them in pain. So I think we had 4 steps. I think there were 4 solid steps in there that I'll put them in the show notes. That'll be
Yeah.
real solid to help people wherever they're at. If they're in, Paducah, Kentucky, or Spokane, Washington, or wherever they're at, that they could find
Yeah.
their own physical therapists that have similar values and caring and sensitivity that they're bringing to the table, that it's in their best interest. It's in everybody's best interest. So I
Yeah.
think that's good.
Good.
And we're going to have you on again, and maybe in a couple months, see how your practice is going. Oh,
awesome.
And you didn't share about your business story.
I didn't share about that.
business. You started your business like a year ago.
Yeah. I started my business. I started building it like a little bit in 2019. But then I went full time with my business in March of 2020 So right
when
before
the lockdowns,
the pandemic started. Yeah.
Oh
I was
my
like,
gosh.
because my business was picking up, and I was like, okay, it's the time to do it.
Yeah.
And then the pandemic hit, and then I was just at home.
I just want to give you major props, because it's like the timing of all of that, right when lockdowns are happening, you go to start your brand new business in like the official space to see people, and you're a friggin' rock star, because you did in the past year, because we're in April of 2021, during a pandemic, when all of this lockdowns and masks and all this other crazy stuff that's going on there, you had to bring on people this year because you're doing so well for people. Think about that. That is pretty friggin' awesome. Yeah.
Thank you.
So I just wanted to acknowledge that. We didn't cover that at the beginning, but yeah, that's great. So whatever you're doing, keep it up, because the world needs more people like you doing what you're doing. So that's fantastic. But we can check back in a few months to see if there's other, you're going to have afterthoughts after we're off of this.
That'd be great.
Bring something else on, some other angle, and share it with our listeners, and we'll go from there.
Okay. Sounds awesome.
Awesome. Well, Angel, thank you so much for being here. Thank you
for having me, Bill.
Oh, you're welcome. And so this is Bill Paravano, the knee pain guru, on behalf of the Pain Education Podcast, sponsored by the Comella Foundation. Thank you all for being here. Have a wonderful day, and we will see you on the next one. To learn more about the work we do at the Comella Foundation, please visit our website at the Comella, COMELLA foundation.org. Join us next week for another conversation on natural healing methods to eliminate pain.